along with thyroid. Sleep apnea is one of the most commonest disorders in today's lifestyle. Middle age group between 35 and 60. This is so very common. And typically in modern medicine, the only way is, well, they put you on a PPAP machine and you have to be with it for life. Basically, one of the things is it's a potentially difficult sleep disorder because it can cause suffocation, choking, it can block your airways. The only symptom you would know is snoring and sudden difficulty in breathing and choking. If you have that, first get yourself diagnosed. But the good news is that homeopathy has a long-term treatment for sleep apnea. And I have many cases of sleep apnea which I improved, which I have put them off PPAP machine. Remarkable. The way homeopathy acts at a deeper level and helps your innermost state, innermost healing power to take over and build your spasms, etc., to reduce, to make your throat muscles to be more relaxed. Somewhere I've seen in cases of obstructive sleep apnea, there is somewhere some stress beneath that people can't actually experience, and it's at so much deeper level that it comes out through this. So first of all, introspect and look within what actually the issue is and find a good homeopath. I had a recent case. It was a case actually who came to me with hypothyroid, and I treated him for hypothyroid. He was this very fast paced person. He wanted to do everything very fast. He would eat fast, he would drink fast, he was everything fast. He wouldn't wait. He wouldn't wait for a follow. I want fast. I want to come fast. I want to go faster. His thing was very, very fast paced. Along with hypothyroid, he also was diagnosed of sleep apnea. I gave him a remedy, homeopathic remedy, which is a very, very need to do everything very hurried. I gave him sulfuric acid and sleep apnea, and he was on BPAP machine. And every month I would reduce the need to take it. First I told him take it alternate day. Then I told him take once a week. And now 1 year has passed and he's off the machine. A remarkable change with sulfuric acid. And this is the power of homeopathy. So I'm here to talk to you about sleep apnea, and typically you have to individualize the case. That's the way out. But there are certain remedies which I've used more often, and I want to tell you about them. The number one remedy that we never use in sleep apnea is the remedy Scrotalus cascavella. This is a very important remedy for sleep apnea. Sudden choking, remember. And there is a kind of fears like Belladonna. There's a lot of fear inside. Dreams of death, fears of death. This is what I've seen. Very clairvoyant people. They can actually feel what's going to happen. The next remedy which I've used is Grindelia. One of the keynote of Grindelia is, along with this choking, there may also be a little dry cough, and they'll just get up suffocated. Typically, they may also have cardiac or respiratory issues later on. They have a lot of dreams that they will talk about. Another remedy that I use very often is the remedy opium. There has to be a history of a lot of abuse and fear in the childhood to give opium in cases of sleep apnea. Spongia. In spongia, I've seen a lot of anxiety actually. So typically patients who have anxiety disorder along with sleep apnea, they can't breathe, they can't do anything, they get up, they're suffocated, they need to walk, they're very fearful. I've used spongia very well. Digitalis, also one of the remedy. Especially with cardiac pathology, I've used digitalis more often. Remember, digitalis has grief as much as agnosia. You can read Clark's Materia Medica for that. Lachesis typically has the symptom of suffocation on falling asleep. So that's one remedy. But I want to tell you, you have to individualize the case. That's the way out. And homeopathy is the solution for this disorder. So if you have sleep disorder, if you have patients' sleep disorders, find a good homeopath, let him analyze in depth, and wait and watch. Analyze, follow up. You can write to me.